When we talk about the effects of stress and trauma, one of the areas we tend to neglect is our physiological responses to danger and threat. A lot of focus has been placed on the brain's capacity to handle stressful events. However, as mentioned earlier, there are many systems that play a role in managing risks and creating new patterns of behavior. One of those systems includes our autonomic nervous system. The purpose of understanding how our bodies respond to stressful and traumatic events is to show that our responses serve an adaptive function aimed to help us survive threat and danger. In recent years, one of the systems that has been examined to play a role on how we respond to stress and trauma is the vagus nerve. The vagus nerve is part of our autonomic nervous system that responds to daily stresses. These responses tell us how we feel emotionally, physically, and psychologically about our environment. Every second, our autonomic nervous system is constantly scanning our environments for cues of safety, danger, and life threat. This process often happens outside of our awareness. The autonomic nervous system is made up of two branches: the fight-flight system, also known as the sympathetic nervous system, and the free system, also known as the parasympathetic nervous system. However, for the purposes of learning, we will stick to the terms fight, flight, and free systems. The fight-flight system is in the middle region of the spinal cord. This system prepares our bodies to move in response to danger by triggering adrenaline to our heart and muscles. The free system focuses on the vagus nerve, which is indicated in our diagram. This system travels from the brainstem in two directions: upwards to our face, ears, eyes, and throat, which is our ventral vagal pathway or our connection pathway, and downwards to our heart, lungs, diaphragm, stomach, and reproductive system, which is our dorsal vagal pathway or our disconnection pathway. For the purposes of learning, we will stick to the terms connection pathway and disconnection pathway. The fight-flight system and the free system respond to safety, danger, and life threat in a hierarchical manner. Therefore, when we feel safe and connected, our connection pathway, which is the nerves in our face, eyes, ears, throat, are activated. However, when we feel threatened, our connection pathway deactivates and our fight-flight systems, as well as the disconnection pathways, take control to protect us from danger and threat. Confused? Let us use the analogy of a ladder. If you examine our diagram closely, you will notice that the ladder represents the three levels of the autonomic nervous system. The top of the ladder represents the connection pathway, which is the nerves in our face, eyes, ears, and throat. This pathway often gets activated when we experience feelings of safety from our relationships or our environment. When these nerves are activated, we experience the world as having endless possibilities. We also have the desire to reach out to people, maintain connections, and our ability to tune out distracting noise and focus on conversation increases. Emotionally, we feel satisfied and happy. Physically, our heart rate is normal, our immune system is strong, and our breath is wholesome. However, when we experience a stressful event such as a disagreement with a spouse or losing a job, our body begins to move down the ladder. The next level is our fight-flight system. This system gets activated when we experience danger in our environment. In this state, our heart rate increases, our breath becomes shallow, our eyes stop seeing friendly faces, and our ears begin to focus on sounds of danger. At this state, we experience emotions such as anxiety, anger, or fear. When we stay in this state for prolonged periods of time, we may experience problems with our relationships, work, or school. Additionally, health problems would include chronic pain, heart and stomach problems, high blood pressure, and memory impairment. Sometimes, if the problem persists and we have tried everything to deal with the stressful event, we move down to the bottom of the ladder. Here, our disconnection pathways take over and our body shuts down in order to conserve as much energy as possible. At this state, we experience emotions such as hopelessness, abandonment, or disconnection. Health challenges may include chronic tiredness, low blood pressure, and stomach problems. Our ability to maintain connection with others requires a reciprocation of safe and trusting relationships. When we reach out to others for comfort or isolate ourselves from others, this is often guided by our fight, flight, and freeze systems, which respond to the cues of safety and danger in our environment. Through awareness, it becomes easier to track our responses to triggers and apply healthy coping mechanisms.